Well, that statement from the Health Department today has given hope to healthcare workers around the country, saying that government can confirm those vaccines from the Serum Institute of India. 1 million doses in January, 500,000 doses in February. But what about the millions of other South Africans? It is being reported that a co-financing plan has been developed by the government, medical aid schemes and businesses. Now, that involves medical aid schemes purchasing the vaccines for a higher price. The surplus generated from those purchases will be used to cross-subsidise South Africans who are not on medical aids. The government has put together a vaccine acquisition task team, which is chaired by the founder of Discovery, Adrian Gore. To discuss tonight, we're joined by Ron Wheelan, who is the Chief Commercial Officer at Discovery Health. Mr. Wheelan, thank you for being with us. Firstly, your response to the announcement today about those vaccines for healthcare workers. Good news.
Well, yeah, good evening to you and your viewers this evening. Yeah, nice to be with you. Thank you for hosting us. Yeah, excellent news today. I think 1 million doses will go a long way to vaccinating a good portion of South Africa's frontline healthcare workers. We obviously need more doses than that, but we've got another 500,000 coming in February from the looks of things. And yeah, hopefully we'll be on track towards vaccinating 1.25 million healthcare workers before long.
All right, now tell us about this plan with medical aids and government. Firstly, is it signed and sealed? Is this the way things are going to work?
Well, this is a very exciting public-private partnership, and as has happened throughout the course of COVID, there's been lots of public-private initiatives. The Solidarity Fund, B4SA, Discovery, as you know, built the COVID Alert app alongside the National Department of Health, and this is just an extension on those public-private partnerships. Effectively, what it means is that the COVAX facility will fund vaccines for about 10% of South Africa's population. This new medical aid or medical scheme funding mechanism will fund vaccines for a further 35% of the target population, so about 14.2 million beneficiaries of that scheme, and then the government and business will fund the rest. So this really puts us on a pathway to achieving that target of 40 million people vaccinated within 2021.
So the idea is that medical aids, like Discovery, will pay more for the vaccines coming in. Then one will go to a medical aid member, and that will subsidise another for a non-medical aid member. Is that fair enough for medical aid schemes to get involved when the coffers just don't have the money, when government needs help? Do you believe it's fair?
Well, I think firstly, just to clarify how the mechanism will work. So there are 7.1 million adult beneficiaries of medical aids in South Africa, so 7.1 adult members of medical aids. By law now, because of COVID vaccination being prescribed minimum benefit, medical schemes must fund vaccination for their medical scheme members. So those 7.1 million members are already funded. And Discovery Health Medical Scheme already ring fence funding for that in November. In addition to that, the cross-subsidisation will allow for a further 7.1 million people in the public sector to enjoy access to the vaccine. This is not an unusual mechanism, by the way. So what we find in South Africa's healthcare system is typically the private sector pays a premium on medicines and medical devices, and then that cross-subsidises the public sector. So it's not an out-of-the-ordinary mechanism for South Africa to employ.
What does it mean for a company like Discovery? Would you actually save down the line because you're paying a little bit more for vaccines, but people will get vaccinated and you're not having to pay for them in hospital?
Yeah, there's a number of benefits to this scheme. I think the first thing is that we drive towards herd immunity faster, and herd immunity is to the benefit of the public sector, the benefit of the private sector, and it helps us get over this epidemic faster, and it gets our economy moving faster. So that's the other one major benefit of the scheme. I think the second benefit of the scheme is pooling funding. If you're pooling funding, it gives you much stronger negotiating power with the manufacturers globally. And in fact, what we found with manufacturers globally is that their preference is to negotiate with one single entry point into any country.
So now what happens, because there's this task team, Adrian Gore, part of that, but will government still spearhead the talks with manufacturers, or now does the private sector get involved in those negotiations as well?
Yes. So as I said, it's a public-private partnership. So everyone is working together to accelerate the procurement of vaccines. The partnership is headed by the Minister of Health here personally. As you rightly mentioned, Adrian Gore, CEO of Discovery, leads the task team on a day-to-day basis. That task team works together to engage manufacturers across the globe in terms of securing supply of vaccines.
So do you know where those talks are? Obviously, this was under wraps, the talks with India. The health minister said he couldn't reveal it earlier because of deals to basically keep quiet. But a lot of criticism, a lot of people are questioning why South Africa has been a bit slow off the marks, the starting blocks to go and negotiate with those manufacturers. Do you know where the process is right now?
So there are extensive talks underway, and the talks are advancing very quickly on a number of fronts with a number of manufacturers. The fortunate position we're in globally is that the initial vaccines have been very successful and very efficacious. And the vaccines that come on the back of that will likely be equally efficacious. We've got a pipeline of over 50 vaccines in human clinical trials globally at the moment. There are 3 approved globally, as you'll know. But we're confident that pipeline will grow significantly over the next 3 to 6 months, which give us lots more opportunity for engaging manufacturers across the globe.
So what's the timeline for you? When do you believe your medical aid members will be able to go and get the jab?
Well, it's all going to be based on a priority system, as the minister mentioned. So all vaccines go into a central pool. Those vaccines then get distributed according to priorities. We'll start out with frontline healthcare workers, probably then move to essential workers across South Africa, then move into high-risk categories. So more elderly populations, people with comorbidities or other diseases and more severe the potential for more severe manifestation of disease. So that prioritization will then play out. So medical aid members will receive vaccine, I guess as soon as possible, but in accordance with the national priorities and guidelines.
So you can't say when you think herd immunity will be reached, for example?
Well, herd immunity is based on vaccinate as quickly as possible to get as many people as vaccinated as quickly as possible. And the quicker we can vaccinate, the quicker we can get to herd immunity.
Final question, is this a great example, like you suggested, of a public-private partnership, especially as we're heading towards a national health insurance?
Yeah, I think it demonstrates the capability that's available in South Africa. And if we all put heads together in South Africa, we can certainly achieve amazing things. And this is just one good example of working together around achieving, in this case, a very, very powerful health outcome.
All right, thank you very much, Ron Wheelan, who's the Chief Commercial Officer at Discovery Health. So not putting a timeline on the table, but suggesting this will be a great partnership to bolster those negotiations with manufacturers. Thank you very much.